Okay. Mr. Nelson, if I may, you had a chance to visit Puerto Rico District Lab in San Juan?
Yes, we did.
Did you?
Yes,
Okay. Did you see any counterfeit toothpaste there?
we did. And
It's exhibit 62, 63, 64, 65 in exhibit book. Is that correct?
that's
We
correct.
can have those up on the chart.
That's correct. And the members should have them in their folders as well.
And this toothpaste contained diethylene glycol.
That's correct.
Okay. And I'm going to ask that exhibit number 63 be put up. I want the toothpaste. Did you see the combination toothpaste and toothbrush kits?
Yes, and initially after the FDA put out its initial import alert, we dealt with toothpaste, and what the San Francisco district office found, because they went on a sweep with the Commonwealth of Puerto Rico's health officials.
Okay, let me interrupt you there now. They put out an alert for toothpaste containing the diethylene glycol, right?
Right.
Okay, then what happened to get around this alert?
The importers were entering the combination toothpaste and toothbrushes, and therefore they weren't being detained.
So if they had a toothpaste with a toothbrush attached to it, they were called toothbrush. Therefore, they avoided the FDA's import alert.
Initially, that's true until the Puerto Rican FDA, the office in San Juan, discovered the fraud.
All right. Now the combinations have they been recalled or import alert been issued on?
Yes, they're now covered.
Okay. Because it also appeared in my district in Penn County, Michigan, these combinations like this has also been. Where would these products be found? They're just small.
In small stores. In the U.S., they're called dollar stores, and actually I think that's a trade name, and other stores. In Puerto Rico, you don't have big Walmarts, Kmarts, Safeways. Food and drugs are purchased in relatively small stores, and so there's a lot of them. Okay. And the Puerto Rican authorities did a good job in trying to get this stuff out of those stores.
But they're not just confined to Puerto Rico, it's throughout the country, these combinations.
Yes, sir.
Okay. Mr. Barstow, if I may explain a little bit more about the FDA import alerts. Specifically, we first learned of import alerts with the detention of the wheat gluten, and that import alert was issued on April 27th regarding the vegetable proteins wheat gluten, and then an import alert was issued on July 10th regarding certain farm-raised fish from China. Both of these are an import alert. Is that correct?
Yes, they are.
The word detention, because in import alert it says detention without physical examination, correct?
Correct.
Okay. The word detention does actually mean that the FDA detains the product?
No, it does not.
What does it mean?
It means that the FDA allows the product to be shipped to the importer. The importer then hires a private laboratory to test the product.
Okay, so the private lab then tests the product, correct?
That is correct.
Is there any way for a firm to free itself from the requirement of having its products tested?
Yes, there is.
How's it go?
If a firm has 5 consecutive clean test results that are released by the FDA, then they are not subject to the requirement any longer.
Okay, then after 5 tests, is it automatically lifted, or does the FDA lift the import alert?
The import alert stays, but that firm who was exporting the goods into the United States is no longer subject to having their products tested.
Okay. You had the opportunity to visit some of the FDA field labs, is that correct?
Yes, I did.
Which labs did you visit?
I visited the San Francisco District Laboratory, the Denver District Laboratory, the Winchester Engineering and Analytical Center, and the Northeast Regional Lab in New York.
At these labs, were you able to speak with FDA lab analysis or regarding the private lab work?
Yes, I was.
What did you find out from speaking with these analysts?
Well, every analyst I spoke to about this issue on private laboratories was very critical. I think one deputy lab director who performs private lab reviews said that none of the testing results are completely accurate that he has seen. I think he used the words not good and spook.
These very labs are responsible for analyzing dangerous and potentially deadly food that enters in the country.
That is correct.
Does the FDA credit these labs?
No, they do not.
Did this deputy laboratory director, does he go through and inspect these private labs?
No, he doesn't.
Does the FDA debar, so to speak, or prevent certain labs from performing tests on food coming in the United States?
No.
So these private labs are free without any kind of accreditation, review, a procedures process, or anything from the FDA?
Yes.
Okay. Well, my time is up. I still have many more questions. We may come back for a second round. I next turn to Mr. Whitfield for questioning, please.
Thank you.